1. Dr. Rosa's knee examination for Toto. Action!
Okay, right, knee examination. This is your mantra again. Look, feel, move. Hi, I'm your surgeon. Do you mind if I examine your knees?
Of course.
Alright, okay. Same as always, this is back on introduction. Now, have a good look, and what you're looking for here is you're looking for asymmetry, you're looking for scarring, you're looking for signs of any obvious swelling. If I could get you to sit further back on there now. And from the foot end of the bed, come around the front and have a look at two deformities. Two deformities I want you to look for are a Varus deformity, which will give you a bowed leg, and a Valgal deformity, which will give you a knock knees. So if you ever get stuck and you can't remember which way is which, a really silly, easy way of doing it, imagine you're a farmer, put your knees outwards, look between your legs and say, Varus, the pig gone. And it'll always get that way, so that's a bow leg. So Varus deformity, Valgal deformity. Look for obvious swellings at the front, and look for obvious swellings around the back, looking for things like a popliteal bursa. Next thing, you've done your look, you're moving straight on to feel. Gauge the temperature with the back of your hand, moving slowly downwards, and always comparing left with right. Next thing you can do is looking for a suprapatellar bursa, and then moving on for a patellar tap. So if you milk the suprapatellar bursa downwards, any fluid which is now behind the back of the patella, you can press down on. Take your hand, put it on the side, tap down. Same again on the left hand side, tap down. If there's an infusion or inflammation, you will have fluid there, and you can feel it on a tap. Next thing, come and move yourself further down here again. Right, so now we've done look, we've done feel, now we're actually on to moving. You really want to be assessing and seeing how much movement somebody's already got. So this is now passive movement. So if you, active movement, if you just straighten your leg out, so that's full extension, bring your foot all the way back, that's full flexion. Same again on the left leg. Full extension, bring it way back, full flexion. Take hold of the leg. Now we can assess movements and the ligaments around. Remember your ligaments. Medial collateral ligament, lateral collateral ligament. You've got your anterior and your posterior cruciate, and then you've got your menisci as well on either side. Easy, simple one to start off with. Take the weight of the leg in your hand, and with a little bit of exaggerated stress, you're trying to push the knee medially whilst you're trying to push the leg laterally. And all we're doing then is just moving it. And you can see that that is rock solid. Swap hands over, again you're moving it in the opposite way. Nice and stable. Same on this one. This one, you're checking the lateral collateral ligament, pushing upwards, and that's nice and rigid. And it's nice and rigid medially too. Bending the knee down, we take the weight of the knee. If you sit yourself back there now, if you bend your knee up, bend it in the middle to there. Take a look on the side, and you're looking to see if there's a step back. If the tibia is looking like it's moving posteriorly, you've got damage of the posterior cruciate. And you can do something called Lachmann's test, or the anterior draw test, where you relax the hamstrings at the back and you pull forwards. As you pull forwards, you're seeing if the ligament draws forwards, and it doesn't. Pop this leg down flat, this leg up. Same again here. You look from the side, and it's absolutely fine. You can also check to see if it doesn't move backwards by pushing straight back. And that's absolutely rigid. Bringing the knee down now, what we need to check now are the menisci, and you can do this with a special type of test called McMurrays test. If you lie yourself down flat, if I take the weight of your leg, bend it in the middle, if you bend it to 90 degrees, now with it stable, twist your foot laterally, place your hand over the top of the knee, and you bend it forwards. If you straighten it up, and you're feeling for a click, then twist your foot inwards, fingers over it again, bring it down, and you're feeling for a click. Same on this one. Bend your knee there, twist your foot outwards, hand over the top of the knee, straighten the knee, straighten down. There. Straighten on the inside, straighten it again. Straighten, straighten, straighten. And there's no click on there at all. Bring it down. One thing that I forgot to do right at the very start when you're feeling it is feeling around the joint line. So it's always sensible to feel on both sides around the joint line with the leg extended, bend your knee in the middle, and your knee flexed. With the knee flexed, you widen the joint space, which gives you more option and ability to press around the patellar tendon on the top. And no examination of the knee is complete by if you're just asking the patient to sit up. If you sit like that, get yourself down here. And just getting your patient to hop down. I won't get him to walk now, but you get him to walk backwards and forwards and have a look. And that's a knee exam. Done. That's it now.
Press it down.